You wake up with that sharp, burning pain shooting from your lower back down your leg, and suddenly even simple things like standing up from a chair or walking to the kitchen feel intimidating and exhausting. If you're over 60, you may have been told this is just part of aging, but what if 3 specific movements could calm the irritated nerve and help you feel steady, confident, and in control again? Sciatica is not a disease on its own, and that distinction matters because understanding the source of the pain changes how we approach relief and long-term recovery. When patients over 60 describe a sharp electric sensation traveling from the lower back into the buttock and down the leg, what they are actually describing is irritation along the pathway of the sciatic nerve. This nerve is the largest in the human body, formed by several nerve roots that exit the lower spine and travel through the pelvis before descending into each leg. When one or more of those nerve roots become compressed or inflamed, the signal that travels along that nerve changes, and pain is the result. After the age of 60, the most common contributors are structural and mechanical rather than mysterious or random. The discs between the vertebrae gradually lose hydration and elasticity, which reduces their ability to cushion and maintain space between spinal bones. As those discs thin over time, the openings where nerves exit the spine can narrow, a process known as foraminal narrowing. Even a small reduction in space can increase pressure on a nerve root, especially when combined with inflammation. In other individuals, spinal stenosis develops, which means the central canal that houses the spinal cord becomes tighter due to thickened ligaments or arthritic changes. These age-related shifts are common, but common does not mean untreatable. It is also important to understand why the pain radiates rather than staying isolated in the lower back. Nerves function like electrical cables carrying signals from the brain to the muscles and back again. When a nerve root is irritated at its origin in the spine, the brain often interprets that signal along the entire distribution of the nerve. That is why someone can feel discomfort in the calf or foot, even though the compression is occurring higher in the lumbar region. This phenomenon is well documented in neurophysiology and explains why focusing only on the spot where it hurts often fails to solve the problem. Muscle support around the spine also changes with age, and this plays a larger role than many people realize. Research shows that deep stabilizing muscles such as the multifidus and transverse abdominis tend to weaken when people become less active or experience repeated episodes of back pain. When these muscles lose strength and coordination, the spine becomes less stable during everyday movements like bending, standing, or lifting. That instability increases mechanical stress on discs and joints, which can indirectly increase pressure on nearby nerve roots. In other words, sciatica after 60 is often a combination of structural narrowing and reduced muscular support rather than a single dramatic injury. Inflammation further complicates the picture because compressed nerves are highly sensitive to chemical irritation. Studies in pain science demonstrate that inflammatory mediators released around irritated tissues can amplify nerve signaling, making normal movement feel disproportionately painful. This is why even small positional changes can trigger sharp symptoms, especially in the morning or after prolonged sitting. The good news is that nerves are dynamic structures and their sensitivity can decrease when mechanical pressure is reduced and circulation improves. Understanding this anatomy and physiology changes the narrative from helplessness to strategy. Sciatica in adults over 60 is usually the result of predictable mechanical and inflammatory processes that respond to targeted movement, improved muscular support, and gradual decompression of the affected nerve root. When you recognize that the pain traveling down your leg is a signal from an irritated but adaptable nerve, you begin to see why specific exercises can influence that signal in measurable ways. Knowledge replaces fear, and that shift is the first step toward meaningful relief. When sciatica flares up, the most instinctive response is to stop moving and wait for the pain to settle, because discomfort naturally signals the brain to protect and avoid further irritation. While short periods of relative rest can calm acute inflammation, prolonged inactivity often creates a secondary problem that quietly intensifies nerve sensitivity and mechanical strain. Many adults over 60 are advised to take it easy, yet research in musculoskeletal medicine consistently shows that extended bed rest weakens supportive muscles and stiffens joints in ways that delay recovery rather than accelerate it. The spine is designed for controlled movement, not immobility, and its structures rely on regular motion to maintain circulation and tissue health. Intervertebral discs do not have a direct blood supply, which means they depend on subtle compression and decompression during daily activity to exchange nutrients and remove metabolic waste. When someone remains seated or lying down for long stretches, that fluid exchange becomes less efficient, and disc tissues can stiffen. Stiffer discs may reduce the small spaces where nerve roots exit, subtly increasing pressure on already irritated structures. Muscle function changes rapidly with inactivity, especially after the age of 60 when natural muscle mass is already declining. Studies show that even 1 to 2 weeks of reduced activity can lead to measurable decreases in strength and neuromuscular coordination. The deep, stabilizing muscles of the spine, including the multifidus and transverse abdominis, are particularly vulnerable because they respond to precise activation rather than large, visible movements. When these muscles become inhibited due to pain or fear of movement, the spine loses a layer of internal support that normally distributes mechanical load evenly. Joint stiffness also plays a significant role in ongoing nerve irritation, because restricted movement in the hips and lower back alters how forces travel through the spine during everyday tasks. If the hips are not moving efficiently, the lumbar spine often compensates by bending or rotating more than it should. This compensation increases shear forces around discs and facet joints, which can narrow the spaces surrounding nerve roots. In other words, avoiding movement may temporarily reduce discomfort, but it can gradually increase the mechanical conditions that sustain sciatica. There is also a neurological component that makes prolonged rest counterproductive for many individuals. Pain science research has demonstrated that nerves become more sensitive when they are not exposed to gentle, graded movement. Without controlled motion, the nervous system may interpret even mild mechanical input as threatening, amplifying the perception of pain. This process, sometimes referred to as peripheral sensitization, means that inactivity can heighten rather than dampen nerve reactivity over time. Clinical guidelines from spine health organizations increasingly recommend early, structured movement rather than strict bed rest for most cases of sciatica. Gentle walking, targeted stretching, and specific stabilization exercises have been shown to improve functional outcomes and reduce symptom duration in many patients. These movements enhance circulation, promote healthy tissue remodeling, and signal to the nervous system that the area is safe to use within controlled limits. This does not mean forcing through sharp pain or ignoring warning signs, but it does mean replacing fear-driven avoidance with strategic, evidence-based activity. The goal is not intensity or exhaustion, but precise, tolerable movement that restores muscle engagement and reduces mechanical stress on the irritated nerve root. When you understand that the spine thrives on controlled motion and that nerves adapt positively to gradual loading, the idea of gentle exercise shifts from risky to restorative. That shift in perspective lays the foundation for the 3 specific exercises that follow, each designed to calm irritation while rebuilding support in a way that respects the realities of aging tissue. The first exercise focuses on improving how the sciatic nerve moves within its surrounding tissues, because irritation is often worsened when the nerve loses its normal ability to glide smoothly during daily motion. In clinical rehabilitation settings, this technique is known as a nerve glide or neural mobilization, and it is widely used by physical therapists to reduce radiating leg pain without aggressively stretching already sensitive structures. Unlike traditional hamstring stretching, which can sometimes aggravate symptoms, a nerve glide is designed to gently tension and release the nerve in a controlled, rhythmic manner. To understand why this matters, it helps to remember that nerves are not rigid cords but living tissues that need mobility to function properly. The sciatic nerve travels through multiple anatomical regions, including the lower spine, pelvis, and back of the thigh, and it must slide slightly as you bend your hip, straighten your knee, or move your ankle. When inflammation, swelling, or surrounding tissue tightness restricts that movement, mechanical stress can accumulate along the nerve pathway. Research in neurodynamics has shown that restoring controlled sliding motion can decrease pressure sensitivity and improve functional tolerance in people with radiating leg pain. A safe and accessible version of this exercise can be performed seated in a firm chair with both feet flat on the floor and the spine upright but relaxed. Begin by slowly straightening the affected leg in front of you while gently flexing the ankle so that the toes point toward the ceiling. As you extend the knee, lift your chest slightly and allow your gaze to move forward, which reduces tension in the upper portion of the nerve pathway. Then reverse the motion by bending the knee back down while gently pointing the toes and allowing your chin to tuck slightly toward your chest. This coordinated movement alternates tension between different segments of the nerve, encouraging glide rather than sustained stretch. The key principle here is rhythm and control rather than intensity, because nerves respond best to gradual loading that does not provoke sharp or lingering pain. You should feel a mild pulling sensation along the back of the leg, but it should ease as you reverse the movement and return to the starting position. Clinical studies suggest that performing 10 to 15 slow repetitions, once or twice, daily can gradually reduce nerve mechanosensitivity over several weeks. Consistency allows the nervous system to recalibrate its response to movement, decreasing exaggerated pain signals. From a physiological standpoint, gentle neural mobilization may also enhance circulation around the nerve root and along its pathway. Movement promotes local blood flow and assists with the dispersal of inflammatory chemicals that contribute to irritation. Improved circulation supports tissue healing and reduces the accumulation of metabolic byproducts that can amplify discomfort. This process is subtle but meaningful, especially in adults over 60 whose tissue recovery may be slower but still highly adaptable. It is important to avoid forcing the leg into full extension if symptoms intensify sharply or linger after the exercise session. The goal is to move within a comfortable range that produces a tolerable sensation rather than a flare. If symptoms centralize, meaning the pain shifts upward, toward the lower back and decreases in the calf or foot, that is often considered a positive sign in spine rehabilitation. It indicates that nerve irritation may be decreasing at its distal distribution. By reintroducing controlled motion to an irritated but adaptable nerve, this first exercise addresses a fundamental component of sciatica that many people overlook. The objective is not to stretch aggressively or overpower the pain, but to restore smooth neural movement so that everyday activities like walking and standing feel less threatening. When practiced consistently and patiently, supported nerve glides can become a foundational step toward reducing radiating leg pain and rebuilding confidence in movement. The second exercise targets a deep muscle in the hip that is frequently overlooked in discussions about sciatica, yet it plays a significant mechanical role in how pressure is distributed around the sciatic nerve. This muscle is called the piriformis, and it sits beneath the larger gluteal muscles running from the sacrum to the upper thigh bone. In many individuals, especially those who sit for prolonged periods, the piriformis can become tight or overactive, narrowing the space through which the sciatic nerve travels. When that space is reduced, even slightly, the nerve can become irritated with movements that would otherwise feel harmless. Research in musculoskeletal medicine has shown that hip mobility is closely linked to lower back load distribution, particularly in adults over 60 whose spinal structures may already be experiencing age-related narrowing. If the hip joint does not rotate efficiently, the lumbar spine often compensates by twisting or bending more than it should during walking, bending, or getting up from a chair. This compensation increases mechanical stress around the nerve roots that form the sciatic nerve. By addressing hip tightness directly, we can reduce one of the indirect contributors to persistent nerve irritation. A safe and practical way to address piriformis tightness is through a modified seated stretch that minimizes strain on the lower back. Begin by sitting upright in a stable chair with both feet flat on the floor and the spine tall but relaxed. Gently place the ankle of the affected leg over the opposite knee, creating a figure 4 position, but avoid forcing the knee downward if it feels restricted. From this position, hinge forward slightly at the hips while keeping the back neutral, moving only until you feel a moderate stretch in the buttock of the crossed leg. The sensation should be firm, but not sharp, and it should not reproduce intense radiating pain down the leg. Hold this position for 20 to 30 seconds while breathing slowly and evenly, allowing the muscle fibers to gradually lengthen rather than resisting through tension. Controlled breathing has been shown to reduce muscle guarding by influencing the autonomic nervous system, which can enhance the effectiveness of stretching. After holding, slowly return to the upright position and repeat 2 to 3 times on the affected side. Performing this stretch once or twice daily can progressively improve hip rotation and reduce compressive forces near the sciatic nerve. From a biomechanical perspective, improving flexibility in the piriformis and surrounding hip rotators increases the available joint space and reduces abnormal tension patterns during walking and standing. Studies have demonstrated that targeted hip stretching can decrease pressure sensitivity in individuals with buttock-related sciatic pain, particularly when combined with strengthening exercises. Enhanced hip mobility also reduces the need for the lower spine to compensate excessively, which helps protect the nerve roots from repeated microstress. It is important to move gradually into the stretch and avoid bouncing or pushing through sharp discomfort, because aggressive stretching can temporarily increase inflammation in sensitive tissues. The objective is to restore balanced mobility rather than to achieve extreme range of motion. If performed consistently, many individuals notice that leg heaviness and buttock tightness decrease within several weeks as mechanical pressure eases. By focusing on the piriformis and deep hip muscles, this second exercise addresses a common but often underappreciated source of sciatic irritation. When hip mechanics improve, the entire lower back and pelvic system functions with greater efficiency and less strain. That improved efficiency translates into smoother nerve movement and reduced sensitivity, bringing you one step closer to meaningful and sustainable relief. The third exercise shifts the focus from mobility to stability, because lasting relief from sciatica depends not only on freeing the nerve, but also on reducing the mechanical stress that irritated it in the first place. When the muscles that support the spine are weak or poorly coordinated, the small joints and discs of the lower back absorb forces they were not designed to handle alone. Over time, that excess load can narrow the spaces where nerve roots exit, increasing the likelihood of compression and inflammation. Strengthening the right muscle groups creates a protective effect that decreases repeated strain on sensitive structures. One of the most effective and research-supported ways to build this protection is through a modified bridge exercise that targets the gluteal muscles and the deep core stabilizers. The gluteus maximus is the largest muscle in the body and plays a critical role in hip extension, posture, and load transfer during walking and standing. When it is underactive, the lower back often compensates, leading to increased lumbar compression. At the same time, the transverse abdominis and multifidus muscles act like an internal brace for the spine, creating subtle tension that stabilizes each vertebral segment during movement. To perform a safe bridge variation, begin by lying on your back with your knees bent and feet flat on the floor, hip width apart. Place your arms gently at your sides and allow your shoulders and neck to relax against the surface. Before lifting your hips, gently draw your lower abdomen inward as if preparing for a light cough, engaging the deep core without holding your breath. Then press through your heels and slowly lift your hips until your body forms a straight line from your shoulders to your knees. The movement should feel controlled and deliberate rather than forceful. Hold this elevated position for 5 to 10 seconds while breathing steadily, focusing on squeezing the gluteal muscles rather than arching the lower back. Then lower your hips slowly back to the floor, maintaining abdominal engagement throughout the descent. Perform 8 to 12 repetitions, resting briefly between sets, and aim for 2 to 3 sets depending on your tolerance. Research in spinal rehabilitation shows that progressive strengthening of the gluteal and deep core muscles improves pain scores and functional outcomes in individuals with chronic low back and sciatic symptoms. From a biomechanical standpoint, stronger gluteal muscles improve how force is transmitted from the legs to the torso during everyday activities such as climbing stairs or rising from a chair. This reduces the shear and compressive forces placed directly on lumbar discs and facet joints. Improved deep core activation enhances segmental control of the spine, preventing small but repetitive movements that can irritate nerve roots over time. Together, these adaptations create a more stable environment around the lower spine. It is essential to move within a pain-free or minimally symptomatic range, because sharp increases in leg pain indicate that the nerve is being provoked rather than supported. Gradual progression is key, and once the basic bridge feels manageable, variations such as slower tempo or extended holds can increase muscular endurance safely. Strength improvements typically develop over several weeks, but even early activation can improve how supported the lower back feels during daily tasks. By strengthening the muscles that protect and stabilize the lumbar spine, this third exercise addresses one of the core mechanical drivers of sciatica after 60. Relief becomes more sustainable because the underlying forces acting on the nerve roots are reduced rather than temporarily masked. Stability, when built methodically and consistently, transforms the spine from a vulnerable structure into a supported and resilient system. Now that you understand the purpose behind each of the 3 exercises, the next step is knowing how to use them in a way that promotes both fast relief and long-term stability. The body responds best to consistency and gradual progression rather than intensity or sudden effort. In adults over 60, tissues remain highly adaptable, but they require clear signals delivered repeatedly over time. When those signals are structured correctly, irritated nerves calm down and supportive muscles become more responsive. A practical starting plan is to perform the nerve glide once or twice daily, especially during periods when stiffness tends to increase, such as in the morning or after prolonged sitting. 10 to 15 slow repetitions are usually sufficient to stimulate neural mobility without provoking irritation. The piriformis stretch can be performed after the nerve glide, holding each stretch for 20 to 30 seconds and repeating it 2 to 3 times. This sequence allows the nerve to move more freely before addressing muscular tightness that may contribute to compression. The bridge exercise is best performed once daily in the beginning, with 8 to 12 controlled repetitions for 2 to 3 sets. As strength improves and symptoms decrease, you may gradually increase hold time or add a third set if tolerated comfortably. Research in spine rehabilitation suggests that noticeable improvements in pain and function often occur within 3 to 6 weeks when exercises are performed consistently. Early changes may include reduced morning stiffness, improved walking tolerance, and less frequent sharp radiating episodes. It is important to monitor how your body responds over 24 hours rather than judging the effect immediately after a session. Mild muscle fatigue or temporary tightness can be normal as tissues adapt, but significant increases in leg pain that persist into the next day indicate that the dosage may need adjustment. In that case, reduce repetitions or intensity slightly and progress more gradually. This measured approach respects the biology of aging tissue while still encouraging adaptation. You should also be aware of warning signs that require medical evaluation, such as progressive leg weakness, loss of bowel or bladder control, or numbness that spreads rapidly. These symptoms are uncommon but important to recognize because they may indicate more serious nerve compression. For most individuals, however, sciatica improves with structured movement, improved muscular support, and decreased inflammation. Fast relief often begins with reduced nerve sensitivity, which can occur within days to weeks as mechanical pressure decreases and circulation improves. Lasting relief develops when strengthened muscles consistently protect the spine during daily life. Walking, light activity, and avoiding prolonged static positions further enhance the benefits of these exercises. Together, these strategies shift the environment around the nerve from reactive and compressed to supported and mobile. As you move forward, remember that pain does not automatically mean damage, and age does not automatically mean decline. The nervous system and musculoskeletal system retain the capacity to adapt at every stage of life when given the right stimulus. These 3 exercises are not random movements but targeted interventions grounded in anatomy and rehabilitation science. If you found this guidance helpful, continue building on it by staying consistent and listening to your body with patience rather than fear. Share this information with someone who may be struggling silently with leg pain, and consider subscribing so you do not miss future evidence-based strategies designed to help you move with confidence. Relief begins with understanding, and lasting improvement begins with action.